Hello. We hope your revision for the MLA is going well so far. This brief video is intended to walk you through a useful approach to answering the sort of SBA question you will come across in your Applied Knowledge Test, or AKT. When we write questions for the AKT, examiners are asked to check that their items pass what we call the cover test. That is, if you covered the 5 answers up and just looked at the question stem, would you be able to get the exact correct answer without looking at the other potential answers? This is a good place to start when you're sitting the AKT. Don't rush to look at the potential answers. Take a second to digest what you've been told in the question stem, and see if the answer comes to you before you look at the 5 options you've been given. If an answer comes to you and it matches one of the potential answers given, then that's the one to go for. You may have saved yourself getting lost in the weeds by looking at all the options too early. If nothing comes to mind, or your answer doesn't match one of the answers given exactly, then it's important to remember the B in SBA. You are being asked for the best answer out of a number which could all be appropriate to some extent or another, but not as appropriate as the single right answer. You will have to use clinical reasoning to filter between the options. This means you will have to identify the most relevant contextual information given in the question, prioritize its importance, and evaluate it to find the most likely diagnosis or the most appropriate investigation. Let's look at an example. An 85-year-old woman with a history of hypertension, osteoarthritis, and well-controlled heart failure presents to the emergency department after experiencing 2 episodes of transient loss of consciousness over the past week. Both episodes occurred while she was sitting in her chair and lasted for approximately 30 to 60 seconds, with a rapid return to baseline and no postictal confusion. She denies any chest pain, palpitations, or preceding lightheadedness. Her current medications are given here as ramipril, bisoprolol, furosemide, and paracetamol. Her blood pressure in the emergency department is 130/75 and her heart rate is 68 beats per minute and regular. Her 12-lead ECG shows sinus rhythm with left ventricular hypertrophy but no acute changes. The question asks you which of the following is the most likely underlying cause of this patient's transient loss of consciousness. Option A, atrial fibrillation with brief periods of rapid ventricular response. Option B, carotid sinus hypersensitivity. Option C, intermittent third-degree atrioventricular block. Option D, orthostatic hypertension. Option E, vasovagal syncope. Let's start by identifying the most relevant clinical information. We have her age, which is 85, we have the fact that she lost consciousness while sitting, and we have the fact that she had a rapid return to baseline, and we have the fact that she had no preceding symptoms like lightheadedness or palpitations. We also have the investigation results. She has left ventricular hypertrophy on ECG. Now, you may have got the answer without looking at the potential options. Intermittent third-degree AV block, which is option C, is the most likely explanation in an elderly patient with underlying heart failure and left ventricular hypertrophy. This condition involves the intermittent failure of electrical impulses from the atria to reach the ventricles, leading to transient periods of asystole and subsequent loss of consciousness. The sudden onset while sitting and the rapid recovery are consistent with this. But if you didn't get this answer straight away, let's look at the other options. The fact that this occurred while sitting can lead us to excluding options D and E. Vasovagal syncope and orthostatic hypertension are both usually triggered by standing or changes in posture. Let's now consider the fact that she had no preceding symptoms. This makes option A unlikely. Atrial fibrillation can cause syncope, but it is often associated with palpitations or an irregular pulse, neither of which are reported. Carotid sinus hypersensitivity, which is option B, is triggered by neck movements or pressure on the carotid sinus, which is not described as a precipitating factor here. So here you can see all the options are potentially plausible, but option C is the right one. We hope this helps you in some way. Come back to our website for other useful videos and for our huge bank of mock exams, all of which have been written by UK-based senior clinical academics and NHS consultants. We add 4 new mocks each month, so it's worth looking again at the bank if you haven't visited us recently. Best of luck in your upcoming MLAs.